Good afternoon, everyone, and thank you for joining us. This is Raphal Medical Centre. We are located in Tema Community 10 and in Tema Community 1 behind TDC. This is the second lecture on autism. Our first lecture was on what is autism and what caregivers should look out for. And today we will be talking about how autism is diagnosed and what steps parents should take. Our resource person is Dr. Evelyn Abena Oppongwaa Dumor. She's a pediatrician with expertise in newborn health, child development, neurodevelopmental disorders, particularly Autism Spectrum Disorder, and Attention Deficit Hyperactivity Disorder. She is a strong advocate for Learn the Signs, Act Early. She is married to her amazing husband, Professor Koshi Dumor, and she's blessed with 3 children. She loves cooking and gardening. So our link after the lecture, we'll be sending. Okay, so the lecture is streaming live on Facebook at the moment. After the lecture is done, we'll post links on our social media pages so that you can follow us if you didn't join in early. Thank you. So Dr. Dumor, if we can start now, please.
All right. Thank you, Belinda. Can you hear me?
Yes.
Okay.
Yes, we can.
Thank you so much. Thank you so much for this opportunity. I'm really humbled that, there's so many of us who want to learn more about autism, and this gives us an opportunity to do that. So let me go here, start and share my slide. So we are going to talk about, this is a continuation of the Autism Awareness Series that we started about a month ago. The series contains 3 parts. So what is Autism Spectrum Disorder? And then we are going to talk today about autism diagnosis and next steps. And then the 3rd part will focus on family educational challenges and support. I have no disclosures. I do want to acknowledge the Raphal Medical Centre for taking this up and running with it. It is so important that when you're taking care of a child, it's not just the physical health of the child, but also the developmental health of that child. And I really am grateful to them for giving us this platform for us to have this discussion. This series is also dedicated to Hope Setters Autism Center, also in Tema, who have been taking care of children with autism for at least the last 5 years, and are determined to change the narrative around autism. So we are going to focus on autism diagnosis and next steps. I will take a few minutes just to recap what is autism spectrum disorder for those of you who were not part of it the first time when we talked about this last month. And then we'll talk about screening for autism, and then how autism is diagnosed and what is involved. If you were with us when we first talked about tracking your child's development from 0 to 2 years, I use the slide because I think this is the most foundational understanding when it comes to child development, especially the critical period for brain development. So from the prenatal to 3-year period is the critical period for brain development. That's when the brain develops faster than any other period in life. And this is important because it builds the foundation for all future learning, behavior, and health. By the time a child is 3 years of age, about 80% of that child's brain is fully developed. That is pretty significant. And also, when it comes to early intervention, that becomes even more important because if you think about it, more than 1 million new neuronal connections are forming in the child's brain the first 3 years of life. So just to recap, what is autism spectrum disorder? talked about that this is a disorder that affects development. It affects how a person perceives and socializes with others. So how they talk, how they behave, how they relate to things, how they react to things, people and other situations. Then they have sensory interest and sometimes atypical play. So if you look at how children will play with other children, sometimes children with autism play differently. They may want to be by themselves. Instead of playing with cars or making noises and creative and imaginative play, they may just line their toys. They sometimes have difficulty adjusting to changing situations. So they are not very flexible. And they learn in ways that are different from other people. So we are expecting them to learn in a particular way, but they learn in different ways. And then remember that we talked about autism spectrum, right? Spectrum implies that it varies in how it presents. So you can't have two people with autism present differently. How it affects them, when you get two people with autism, they have the way it affects them is different. And then how it impacts them. So in terms of severity and in terms of their ability to function on a day-to-day basis, there's a difference. It is important also for us to remember that people who have autism may not look any different from us. When you look at them, you may not even be able to tell that they have autism necessarily until you start to interact. It's a condition which starts before age 3 years. There are children as young as 15 to 18 months who have been diagnosed with autism, but it usually starts before the age of 3. Some children may develop normally and then they regress. Other children will just have difficulties that are picked up along the line. The other important part I want us to remember is that there is no cure for autism, but we know that early intervention makes a difference. So early intensive treatments can make a difference. So these are the two main areas when we talk about autism and challenges. They have difficulties with social communication and interaction, and then they have these restrictive, repetitive sensory behaviors. We talked about early signs of autism, right? Which is really important when it comes to parents and caregivers and teachers. You are looking at if a child is not responding with a smile or happy expression by 6 months of age, if they are not mimicking sounds or facial expressions by 9 months of age, if they are not babbling or responding to name by 12 months of age, if they are not gesturing or pointing by 14 months of age, if a child is not saying single words by the time they are 16 months, or they are not playing make-believe or pretend play by 18 months. Remember when you are at that age where you can take a doll, try and feed the doll, or put the doll to bed, or you can pick up sticks and it can be anything. You pick up a stone and that's like an airplane. All these creative and imaginative things that we do, that children do. And then if a child is not using two-word phrases, such as, at that age, they should be able to talk right there. Okay, thank you, give me. In our language, that would be famame or memame wahin, they will tell you, or call simple communicative tools that they can have. And then if they have acquired a skill, but then they lose that skill, that's also another concern for autism. I wanted to focus a little bit on importance of general development and autism screening. So the whole purpose of talking about autism, one is for us to be aware of it, but more importantly, is for us to be able to identify it early. So if we think about the slide which talked about the importance, the typical period of brain development, it becomes even more important for us to identify autism early, because once we identify any developmental concerns early, we can actually work towards early intervention services. Then having an understanding of what is going on with your child means you're going to seek the right kind of intervention. And that is so important. And having the right kind of intervention, that is how you are able to be assured that your child will get the best possible outcomes. I brought in this slide because I wanted to talk a little bit about monitoring and surveillance. So monitoring is part of what we talked about when we talked about tracking your child's development, I think like a couple of months ago. This is where parents and caregivers come in. How is my child growing? How is my child changing over time? Is my child meeting typical milestones, such as is my child playing okay for his age, moving okay, behaving okay, learning okay, speaking like other kids of the same age? The role of parents and caregivers when it comes to this particular area of monitoring their child development is really important. On the other side is something we call developmental surveillance. So developmental surveillance has to do with healthcare workers who are able to look at a child and then have a more formal way of checking their development to see whether the child is developing like they are supposed to. This sometimes may involve some tests, but it also involves using different assessments, specific tools that are available that are used to check a child's development at specific times. So when a parent recognizes that my child is not developing like they're supposed to, that parent reaches out to a healthcare provider who can then do some initial screening measures or developmental surveillance and be able to check and see that the child is and assess the child's development. These are all free screening tools that you can have access to. I like Ages and Stages. The American Academy of Pediatrics has endorsed it. It's a really simple, easy way for a parent to look and see whether the child is developing in different areas. If you remember when we talked about tracking your child's development, we talked about the different areas of development. So language and communication, we talked about physical movement using gross motor, fine motor skills. We talked about personal and social interactions. And then we also talked about problem solving skills. Ages and Stages allows you to look at those. The CDC, Centers for Disease Control, has Learn the Science Act Early. There's even an app that you can download that can help you to track your child's development at a certain age. So what is my 2-month-old doing? What is my 4-month-old doing? Do I have to be worried that my 4-month-old is not doing this at this time? Or at what stage do I start getting concerned? These can guide you. The National Health Service in the UK also has a child developmental tool, and that's also available online. So because I'm in the American system, I tend to do more of the American stuff. But if you're familiar with the UK system, that's also one area to do it. And then in Ghana, we actually have a Ghana Early Childhood Care and Developmental Standards. This is a document which is also available free online. You can look at it, and it talks about different developmental milestones there as well. So I will talk about Ages and Stages because that's the one I use a lot in terms of how I take care of my patients, and also how I use it for my developmental surveillance as well. And this is a tool that looks at developmental progress in children from about 1 month of age to 5.5 years. There's also a social emotional development tool as well. All these tools are tools that parents can complete. So parents complete these tools, and then we will take a look at it and then help explain what is going on there. I put down here just a sample of what the Ages and Stages questionnaire kind of look like. So this is for a 2-month-old, and you know that if you look at it well, you see that it goes through a range, and it does talk about different areas once you start looking at it. This is what Ages and Stages social emotional questionnaire does. This is also a parent completed questionnaire that reliably identify young children at risk for social or emotional difficulties. And this can be important because it can help us to figure out what is going on with a child and evaluate them properly. Specifically, when it comes to screening for autism, it is important for us to understand that screening is not diagnosis, right? Screening is a measure that helps us identify children that are at risk for autism. So one of my favorite tools is called Modified Checklist for Autism in Toddlers, or MCHAT-R. And this is a tool that you can use use for your child, and it ranges from about 16 months to 30-month-old. Autism Speaks have one where you can complete online, and then it will tell you whether your child is at low risk, medium risk, or high risk for autism. It's a very simple and easy tool to use. I'll show you a picture of how it looks like, but there's also a downloadable version of it. And then Autism Navigator has something called Early Signs of Autism. That's also a very easy, it just focuses on 16 early signs of autism. You can complete it online, and it will also tell you where your risk level is. And then another screening tool that I use, this is not free, but this is called a social communication questionnaire. This is also a really good way to look at screening for autism, like the different areas of concern that will help you identify whether a child is at risk. So this is an example of an MCHAT-R. You could find this online, you can download it, and then you can complete it and see whether your child is showing some risk factors for autism. The difference with this tool is that when it comes to the MCHAT-R, if it's on a site where they score and explain, you will be able to see that, oh, my child is low risk, medium risk, or high risk. If not, a screening center will be able to do that for you. Like a healthcare provider who has had some training will be able to look at it and tell you, okay, these are some concerning areas for autism. And then this is how this social communication questionnaire looks like. When it comes to autism diagnosis itself, remember this. There is no specific medical test for autism. So when you think about when somebody has malaria and you have these malaria symptoms, you go to the doctor. Sometimes the doctor will do a blood test checking for malaria parasites. And then once they get the malaria parasite, they'll tell you, oh, you do have malaria. That's a blood test that is done. Autism, on the other hand, does not have a specific medical test. What happens is that there is a team of autism trained specialists that sometimes includes doctors, a psychologist, a neurologist, speech and occupational therapists. And this team goes through comprehensive history. They ask the parents, they look at the child's medical history, educational history, social history, and then they observe the child's behavior and interactions. And then they have a general behavior assessment, and they use these autism-specific instruments to do that. So it is not just I do a test or I get a head ultrasound or a CT scan of my head, and then I know whether my child has autism or not. It is more of an observational test, but it is an objective test. And the reason why this is important is that there are certain conditions that can mimic autism. So they may look like autism, but it is not autism. In addition to that, you may have certain things that a child with autism may have in addition to the autism itself. So speech and language disorders, for example, a child with autism may not have speech, or they may have speech, but do not use the speech functionally, or they may even use the speech functionally, right? This is where the spectrum comes in. So you can have a child who is acting or behaving a certain way, but it's not because the child has autism, it's because the child has speech and language disorder, for example, or the child has autism, but also have speech and language impairment. The other big area is something we call intellectual disability. This is when a person has difficulty with reasoning, learning, problem solving, adaptive behavior function. So you're talking about day-to-day living, how they are able to request their needs and be able to do things on their own independently. In the past, we used to think that when somebody has autism, it means that they are intellectually impaired. But now we know that is not true. People with autism have a range of intellectual abilities. They can be super smart, very gifted, or they may have severe learning impairment. So that's another area that can be confusing, and that's why you need to have an autism trained specialist team to evaluate your child. In addition to that, another condition that can sometimes be confusing with autism is attention deficit hyperactivity disorder. And this also is when a child will not sit still, they are constantly on the go, they fidget a lot, they can't focus, they can't pay attention. A child with autism can have autism and can have Attention Deficit Hyperactivity Disorder, which we call ADHD for short, but they can also a child can also behave a certain way and it is just ADHD. They do not have autism at all. Anxiety is another one. A child who has been abused or neglected is another one. And then there are certain genetic syndromes that can also present like autism. So as a parent, when you are going for an autism evaluation, depending on the center that you are going to, all of these things come together to make that diagnosis. Now, these are some of the tools that are used during autism evaluation. This is a STAT tool. It's called the screening tool for autism. In my state where I practice, this is a very important tool that we use for kids who have autism. These are other objective interviews, structured things that are used as well. So the CARS, or they have all these fancy names, but they are all related to autism. This right here, the ADOS2, is a diagnostic tool. And this tool involves the autism trained specialist sitting with a child, doing different play things, challenging them with offering them different opportunities to interact and to see how a child is going to respond. And all of those things are important when it comes to autism diagnosis. So this just kind of gives you an idea of what is involved when we are doing autism diagnosis. So the other part of it is that when a child is diagnosed with autism, there's always a caveat to it. Is this child having language impairment or does not have language impairment? Does this child have intellectual impairment or does not have intellectual impairment? And then a big change from what autism used to be and now is something we call levels of function. And I'm going to talk about that a little bit because I think it's important for all of us to understand because it changes our perception of what autism is. So we talked about intellectual abilities earlier on as one of the things that when a child with autism is diagnosed is usually added on to the diagnosis. Because it's a spectrum, autism is a spectrum, there's a range in intellectual ability, right? Remember what that is, the ability to reason, problem solve, and to things for daily adaptive function. So you have children with autism who have extreme ability in some areas. You have children with autism who have above average IQ. You have children who have that's above average intelligence there. Then you have children who have average intelligence. And then you can have children with autism who have mild learning disability. They may have moderate learning disability, and then they may have severe learning disability. Most of the time, the child with autism that most people are familiar with is the child who is the one with severe or moderate learning disability. But there are a lot of children with autism who also have extreme ability in certain areas and who have above average IQ. The other one I want to explain a little bit is something we call functional levels of function. So in the past, we are used to seeing children with autism diagnosed as having severe autism or moderate autism or mild autism. Now we look at the child and we look at what level of function that child has in the area of communication. So in the area of language and speech, can they communicate their needs? Can they request? Can they direct attention? Can they function in that area? And then we look at how flexible that child is in terms of difficulties in some of the repetitiveness, some of the things that they do over and over and over again. And so we have three functional levels. Level 3, that means that that's the child who doesn't have a lot of verbal skills. They can't really talk that much. They can't really express what they need. And so they need a lot of support to teach them how to do that. Then you have the child who is in the middle. They still have some difficulties, but they can function fairly okay. And then you have the child who may have difficulty initiating social interactions, but can actually function very well. All these 3 levels of children still need some support, and we just need to figure out what supports that they need. So when a child is diagnosed with autism, currently we look at it based on, is that child a level 3, a level 2, or a level 1? Because that allows the autism team members and the interventions that are going to be made. What I want all of us to remember is that the levels of function only tells us where the child is at the time of diagnosis. It does not tell us where the child is going to be 2 years from now, 3 years from now, 1 year from now. It does not. It only tells you this is where this child is at this level, and this is what we need to work on to get this child to function as best as he can. So where can you get diagnosis for autism for your child? There are very few places in Ghana that you can do that. When you are not sure, always start from an autism-friendly school or centers. Hope Setters, for example, in Tema can offer some guidance. So when you're not sure, you can call and ask them, hey, I have a child, I have some concern, where can I have that child evaluated? And they can give you some guidance on that. Autism Society of Ghana can also do that. There are few diagnostic centers in Ghana. Mission Pediatrics in Accra does some diagnosis, and I think a Ridge Hospital also does some diagnosis. So those are some of the places that you can go to. In addition, I do want us to remember your first stop could also be Raphal Medical Centre, because they will be able to give you some guidance in terms of what you need to do. I saw this quote by Liz Becker, and I thought this is really important. Sometimes all a parent needs is to know the impossible is actually possible. Hope goes a long way when it comes to autism. I am forever optimistic when it comes to children with autism, because having taken care of them for the last several years, I have seen children who were not even talking, were not speaking, saying any words, to a year or 2 of early intervention, now talking in sentences, interacting, and doing a lot better. One of the concerns for parents is, how do I handle this autism diagnosis? So after my child has been diagnosed with autism, parents and families go through so many emotions and reactions, trying to understand, how did this happen? What are we supposed to do? The key guiding principle is, remember that regardless of the autism diagnosis, what every parent wants to do is what is in the best interest of their child. So every parent wants to give their child the best opportunity for that child to have its full potential, to achieve its full potential. It's also important to remember that all of that, when it comes to autism, early intervention and treatment is the way to go. Find an autism-friendly school or center where they can provide services for your child and accommodate the way your child learns. So your child with autism may not do well in mainstream classroom, but if you find a center where they can evaluate that child, they can work towards individual educational goals or plan for that child, your child is going to do better. A place where they can have access to speech therapy or occupational therapy or behavior therapy, that's one of the ways to go. The other big area that gets lost is finding a medical home for your child. And this is where Raphal Medical Centre can be so important. Because children with autism have difficulty with changing situations, and new social situations can be a challenge for them, it helps when they have a place where they can go, that they will feel comfortable, that they are familiar with, and they have healthcare workers who are also familiar with autism and know how to accommodate their needs. So I'll give you an example. Like in my clinic, when I have to see my children with autism, I do not put them with the general patients coming in, because seeing that many people can sometimes be challenging for them. So I have them come in at specific times instead of just doing business as usual. Sometimes I role play with them a little bit. I have parents role play with them a little bit even before they come to clinic, so they know what to expect. Children with autism do better when they know what to expect. So a lot of the things that I do with them is done at specified times. Children with autism can get sick just like any other child. They can have malaria, they can have an ear infection, especially when you have a child who cannot communicate. They may not be able to tell you my ear is hurting, or I'm not feeling well, but sometimes they will show it in the way they act and they behave. Sometimes it could be something as simple as constipation, and then they are so uncomfortable that they will act up because of that. So finding a medical home for them is important, a place where parents and that child can feel comfortable and go and know that they are going to be taken care of and they are going to have access to the needed medical interventions is very important.
Sorry.
In conclusion, I want us to remember, I look at autism as people who have these astonishing, unique talents. Yet all of this is intersecting with some of the challenges, the special challenges and difficulties that they may have. And sometimes they are trying to communicate all of that to us, so using special messages where we have to decode what these messages are. But overall, persons and children with autism just are not any different from us. They just look and interact with the world differently. Thank you, and then we can go to questions and if anybody has any comments. So if anybody has any questions, this will be a good time for it.
Okay. You can ask your questions here, or you can write it in the below.
Yeah, you can unmute and ask your question, or you can type it in too. So Amma just asked whether there are any foods to avoid for a child with autism. That's a very good question, Amma. And there's a third part where we're going to talk about family, educational support and challenges. I think like every other child, it is important for us to be able to see what foods are healthy and good for the child. There's a lot of information about avoiding certain foods when it comes to autism. And we know now that there is so much when it comes to what we take in terms of what we eat and how that can even affect our brain and our behavior. So my take on it always has been that if you find a food that your child takes that can be a problem, you definitely want to avoid that food. However, it is important for all of us to remember that when it comes to nutrition in children, we always want to go the route of healthy, whole grain, non-processed foods that we know that will help that child to get the nutrients that they need. There's a lot of fruits and vegetables. There's a lot of preservative foods that we can avoid, adding extra things to foods that are not needed. And we can go through the healthy routes because it's important. Sometimes children with autism can be very picky with the foods that they want to eat. I have kids that if it's just chips, that's all. They will not eat anything but chips or crunchy food. So it becomes so important when you have to look at the nutritional balance. Are these kids getting what they need to be able to grow? So I think it's important to look at it that way. Anytime you have a child who has some form of food and affects their stomach, there is no point continuing to give it to them. Or if they take foods with dyes and that affects them, you can take that away. We just want to make sure that they're having healthy foods that would help them to grow, and they'll be able to get all the nutrients that they need. So Louisa has a question about, can a child diagnosed with cerebral palsy have autism as well? This is such a good question because most people in our part of the world, there is a little bit of a confusion between cerebral palsy and autism, and those two things are two different conditions. So you think of cerebral palsy as a disorder which affects motor function. It doesn't mean that they are not intelligent. I remember where I did my residency, there was a person who had cerebral palsy who's still trained as a pediatrician, right? So it doesn't limit you in any way in terms of what they can do. It all depends on their abilities and what they are capable of doing. So it's looking at the condition of cerebral palsy by itself, and then whether there are certain other things that that person is doing which is consistent with autism as well. So that you can look at it and say, yes, this person may have underlying cerebral palsy, but is this person also behaving in a certain way which is specific for autism? But the two conditions are not the same thing. So that was a really good question.
Hello. Am I audible?
Yes, we can hear you.
Okay.
Just introduce yourself and then ask your question.
Yes, I'm Amma. I'm Amma again. Yes, I think that's okay for an introduction. Yeah. I want to ask, does that mean that autism has everything to do with the intellectual development of a child, and that's it limits a child's intellectual progression? When you were talking about cerebral palsy, you said that some of them are able to go as high as trained to become whatever, but with children with autism, is that a difficulty for them in the intellectual sense? Thank you.
Thank you for your question, Amma. So earlier in one of the slides, I don't know whether you were there, but you had joined us then, but I talked about the spectrum and the range, right? So whenever we talk about spectrum, we talk about variability. How they present is variable. So that in terms of even intellectual ability, there are children with autism that are exceptionally gifted in certain areas, but then they also have some difficulty. So on a range, they can go from having some gifted ability, so super IQs, very high. They can have above average intelligence. They can have average intelligence. Then they can have mild learning disabilities. They can have moderate learning disabilities, and then they can have severe learning disabilities. So in the same way, I just want us to remember that the fact that a child has autism doesn't mean that that child is intellectually impaired. You can have autism and still have gifted abilities and have an above average IQ. And you can have autism and also have some difficulties with intellectual ability. And currently the literature is looking at maybe it's just about 20 to 30% of children with autism that have intellectual ability. So a vast number of children with autism do not necessarily have intellectual disabilities there.
Thank you.
Hello, good afternoon, madam.
Hello,
Doc. Hello, Doc.
Yes, I can hear you.
Yeah, there is a question. The person says,
Yes. So I just saw a
challenge.
question from Benjamin. Is that what you're talking about?
Yes.
Okay, so Benjamin's question, I'm going to read. It says, my sister's son has intellectual challenge, but he can talk. He can't write certain letters, example, letter C. He flips it from right to left. He can't read. He recognizes pictures. Instead, he knows his friends' houses, their names. Is that one of the observations of autism? He is 14 years old now. Thank you so much for your question, Benjamin. So autism belongs to a group of disorders called neurodevelopmental disorders, and learning difficulties, intellectual challenges, anxiety, ADHD, all of those things are part of neurodevelopmental disorders. So your child, your sister's son may have learning difficulties, which in addition to that, he may have intellectual challenges as well, but it does not mean that he has autism necessarily. So there's different learning conditions. There's dyslexia. We have so many different types of it, which a child can have, but does not necessarily mean that that child has autism. So I think it's important, because you are telling me that your sister's son has these great abilities, right? But he also has some challenges. And he will be one that will be important for you to have, if your sister has concerns, or if you guys have concerns with autism, to have somebody who is trained in autism, who can take a look at him and see whether he meets criteria or not. Because you can have just intellectual impairment without autism. You can have learning disabilities without autism. You can have all these challenges. Yet I see a lot of strength in what you are saying about your sister's son. You know, the fact that he can recognize, the fact that he can recognize pictures means that the way we teach him and the way he learns is different. So we have to meet him at that learning point and use that to teach him things. So he may not be the child who can just sit in a regular classroom, which is not adapted to meet him where he's at, for him to be able to learn effectively. We just need to figure out a way for us to teach him, for him to learn. The second question says, as a parent with a child who is displaying many autistic traits and has been referred to a pediatrician, is there anything that you can recommend that I can do at home with my son to aid his development, excuse me, or help in any way until we are able to meet with professionals? Thank you. He's 2 years old. So this is such a great question. Part of why I am so focused on talking about autism and creating this awareness is that I do not want a child to go for so long without any interventions before diagnosis. Sometimes in the process of waiting for diagnosis, what do you do? So that's basically what you are asking me as a parent. I will tell you this.
Thank you.
The most important interventions start even before diagnosis. You don't need an autism diagnosis to start to look for help, right? So if your child has difficulty with speech and language at the age of 2, that's an important age for you to reach out to a center, for example, that has the ability to have a speech therapist that can work with him, or a behavior therapist that can work with him. I think that when you have a child who is in that early age, between the ages of 2 to 3, that is where the bang for your money is. This is where you want to start your interventions early. On average, I think the age of diagnosis for autism in Ghana is 8 years of age, right? If you look at what we talked about early interventions, we have totally missed all the critical period of brain connections in that child. But you are so blessed, you are still within that period where you can actually start to do something for your child. So think of centers like Hope Centers if it's close by. See if they have a program or the ability to have your child be there, even if it's just a couple of hours a week where your child can have some interventions. That is what is going to give him the best possible outcomes. In addition to that, when we talk about some of the education and family support, there are a lot of tools that can be used, and we'll talk about that in detail. So some of the things that you can do in terms of teaching your child functional skills, trying to teach your child to communicate if they don't have language, using different tools like a picture exchange system. We'll talk about all of that at the next one, but that's definitely something that you can do, is to start to reach out to a place where you know that they focus on autism. They can have an individual educational plan for your child, they can have certain goals set, and they can do some interventions for your child.
Thank you very much. I appreciate it.
Hello.
Hello, we can hear you.
Okay, thank you very much for a good presentation. I have a question with regards to the terminology when addressing children that have autism. So I wrestle with.
Can you talk a little louder? I can't hear what you're saying.
Okay, sorry. I was saying that I sometimes wrestle with the terminology that I have to use to address kids in that spectrum. So should I say autistic kids or kids with autism or mentally challenged? What would you advise?
That is such a good question. I mean, I think that in the past, there were so many labels that were used, which now we know is very insensitive, right? And so we are calling children autistic, but it's kind of associated with stigma. We already know the challenges that parents have to face and their families have to face in our society. And even here in the US, when they have a child with autism, because people do not understand that it's just, this is a different condition in of itself. So saying that a child has autism is probably the best way to say it. It kind of like when somebody has high blood pressure, we don't say the person we don't usually say the person is hypertensive in the negative sense. We will say the person has high blood pressure. So I have a child who has autism. For me personally, I'm not a fan of autistic, but I like the word autism. It's a medical condition. My child has autism spectrum disorder, which is long, but then you can say I have a child who has autism. We don't use mental retardation either because it's also insensitive and inappropriate, and it has some stigma connotations to it. But we use intellectual impairment or intellectual disability because that captures what the person has. I have diabetes, I have autism. It's a condition, it's a medical condition, versus when you say somebody is mentally retarded. That does not sound right. So in terms of what you can use, I think that saying that a child has autism or a child has intellectual impairments or a child has learning difficulties, that is a more appropriate way to use it. But
Okay,
I always say when you're not in doubt, ask the parents. Parents are amazing when it comes to what they know about their children and how they feel about it. And, you know, I don't know, Charlotte is on there. Maybe she might be able to tell us how she feels about this when somebody will say her child is autistic necessarily.
Okay, thank you very much.
So I can see Amma has a question. Have there been any success stories with children who have used diets to overcome the challenges or boost their brain? So thank you, Amma, for the question. There has been a lot of talk about something we call leaky gut syndrome, how certain foods affect the brain and the gut, and how that is connected to the brain and behavior. Personally, as an autism physician, if I have a parent tell me that I use this and it was successful and it helps my child to overcome certain challenges, I am all for that. In terms of scientifically, we know that there are certain foods that can improve a child's attention and can also help improve the way they act. So, for example, when you look at omega-3 fatty acids, which we get from salmon, and we know that omega-3 fatty acids can help improve a child's brain, right? And improve attention in a child's brain. We know that certain things, certain vitamins, certain minerals like magnesium and zinc, they can all have a role to play. I think the most important thing is to remember that whatever food that you're using or whatever supplement that you're looking at the end of the day, does not affect your child in a negative way. And if it affects your child in a negative way, then you have to stop. But if it's not affecting your child in a negative way, but you are making some progress in that regard, and in addition to that, you're making sure that your child is getting the nutritionally balanced diet, which can sometimes be extremely difficult with children with autism, then you're probably on the right path. But then in addition to that, the other thing I want us to remember is that there is not a one size fits all. So you can't, there are not foods that you say, oh, if my child avoids cheese and my child has autism, then it means that it's going to work for another child if their child also avoids cheese. So there's a lot of talk about casein diets, there's a lot of talk about all of those things, but there is not across board how it affects each and every child with autism in terms of overcoming challenges or boosting their brain.
Okay, thank you very much. I think I'm Amma again, and I also want to ask another question. Do you recommend taking drugs that calm the children down? There's a doctor who suggested that if the child is too active, the child needs to calm down to be able to go through the various therapies successfully. So there are some forms of medication that can be used to calm them down. But in my understanding, it looks like then the child becomes dependent on those medications to be able to calm down. And when they go off it, then they may begin to react in another way. So what are the side effects or what are the challenges with some of these medications and their advantages as well? Thank you.
Sure. So thank you, Emma, for your question. So remember that there is no medication which treats autism necessarily, right? But there are medications that can play a role when it comes to some of the challenges that they have. So earlier when I was talking about some of the things that children can have in addition to having autism, we talked about autism and ADHD, for example, Attention Deficit Hyperactivity Disorder, where they are impulsive, they can't sit still, they can't pay attention, they can't learn. It makes it difficult for them to interact, and it makes it difficult for them to learn. So sometimes medication plays a role in a child who has autism for them to be able to learn and be able to do certain things. So if you have a child who is very hyperactive, very inattentive, cannot sit still, cannot focus, cannot do any of that, then it becomes difficult when the therapist is working with them for them to be able to learn and to do certain things. And this is all in addition to when you've tried all sorts of behavior and environmental changes to see whether that would help that child. Sometimes medication is beneficial. So I have children with autism that I put on medication sometimes because it helps them to be able to go through their therapy process and be able to stay focused and do better at school. It all has to do with how that behavior is impacting their social interactions and also impacting their academic development. So if you have a child who is in school who will not sit still at the table, not even for a few minutes, right? So usually you're looking at a child's attention span is about 3 to 5 minutes per year. So if you have a 5-year-old under normal circumstances, they should be able to sit for a good 30 minutes, about 30 minutes to be able to do something. Sometimes children with autism have so much difficulty. Remember, it's a spectrum. So if they have difficulty with sitting still, cannot focus, that child will be evaluated, and then there might be the need for that child to be put on medication. There are different types of medication, so I can't even talk about specifics, right? It depends on what is being used for. I'm a big believer in what you are using the medicine for, going over that with parents so that they know expectations. What is this supposed to do? What are the side effects that you're supposed to watch for? Sometimes even the medication that works for one child may not work for another child. So it has to be looked at that way. In terms of dependence and tolerance, which is what you are talking about, I think is what you are asking. It depends. I have some kids that will be on medication for a short while to be able to help them so they can learn the things that they need to learn to move on to the next level. And I have some kids that take different medications depending on different times or time periods in their lives. And so it's not necessarily that they become dependent necessarily on the medication, so long as it serves a function. I think you need to look at that too. I hope that is a little bit helpful, Emma.
Yes, it is. Thank you so much.
Sure. So there are a few more questions. Says, do you know if caregivers, that is centers or schools do I know if caregivers, centers or schools get governmental support? I don't. What about parents who need support? Where can they get it? I mean, where can they go to get support in Ghana? I think that this would be one that would be a good one also to reach out to the Autism Society of Ghana, because they will be able to kind of give you some guidance there. I don't know necessarily that there are caregivers that get governmental support or schools necessarily. A lot of what I have seen tend to be more private-based institutions that are working towards trying to provide care for children with autism and other developmental disabilities. So that would definitely be, I mean, people living with disabilities, there's an organization in Ghana for that. So sometimes you may have to reach out to some of these organizations, but going through the Autism Society may be one, maybe talking to Hope Setters may also be another one. They can give you some guidance there because they are part of the Autism Society of Ghana as well. Toby has a question that says, what causes autism and does giving birth at a late age cause this? So Toby, thank you for your question. We kind of dealt a lot of that in the first series when we talked about it, that we do not know 100% what it causes, but we do know that there are certain associations, and yes, sometimes parental age can be part of it, but we also know that there are certain things like genetics, having a sibling with an autism or family history can increase the risk. We also know that there are certain changes in genes that happen, so you may not have it at all, but then you can have that. The link to that particular presentation will be provided. So if you want to take a look at it, we delve more into detail as to what the causes of autism is in that one. Benjamin's question says, is there any chance that there can be two children who have autism in one family? And if there can be, do you recommend that the parents don't try to have children after the first one? Well, that is a very loaded question. So the first one is easy. Yes, I have families that have 2 or 3 kids and all the children have autism, but they all present, their presentation is different. So I have a family where, you know, one is very high functioning, can talk, and then the other one cannot. And the other one is in between. So that's a possibility. Do I recommend whether the parents don't try to have children after the first one? I think that is such a personal decision. The fact that you have had a child with autism does not mean that you will not have a child who does not have autism. The risk is there, but I think that is a parent's decision to make. Toby's question, is there a relationship with autism and ADHD? Toby, thank you for that question. So there can be, you can have a child who has autism who also has ADHD. Remember, autism, ADHD, learning difficulties, anxiety, intellectual impairment, a lot of those things are all under a big umbrella of conditions called neurodevelopmental disorders. So they can have some shared overlaps when it comes to that. But children with autism can have ADHD, there's an increased risk for it. But children with ADHD can also have autism as well. And so there is some relation, and you can have a child with ADHD who does not have autism at all, just like you can have a child with autism who does not have ADHD as well. These are good questions. I like this part of the presentation because it allows me to understand how everybody is thinking about what we talked about. Oh, Bob's question says, talking about medication that treats some challenges, I would say that people with autism have. Do you know if local medicines, herbs can do the same? So Bob, I'm not very familiar with herbal medication and the role it plays. So I can't really talk about local medicines and whether that can help. I think that the most important thing is always looking at the safety and whether what you are taking is going to do what it says it's supposed to do. So safety is always a priority for me when it comes to children with autism. Is the local medicine that is being
So
being sold as can't help is that something that really does what it's supposed to do. So I can't really talk about local medicines because it's not an area of strength for me. But I always think of it in terms of safety first. Oh, what about seizure disorders, convulsion, and autism? Is there a correlation? So there's actually children with autism or people with autism have an increased risk for seizures. They can have sometimes what we call subclinical seizures. You may not see them shaking like typical seizures that we are all familiar with, like the child who is shaking, but they can have seizures that are a little subtle. So sometimes they may be staring off into space and you try to kind of snap them out of it and it's not, they are not looking at you, they're just staring, and some of those things can be seizures. And then there's some where they can actually have the generalized seizures as well. So children with autism can have seizures. They are at an increased risk for that as well. So that's definitely something that we look at when it comes to it, which is why having a medical home is important, right? Is there any way to prevent children from autism? Like, is there to prevent children from sickle cell anemia? So Laura, this is a good question. You are looking at sickle cell. So sickle cell is a whole different category because it's a genetic condition. It's a condition where you have an abnormal hemoglobin and you can pass it on from, depending on parents, it can be passed on from, if two parents have one of the abnormal hemoglobins, they can have a child who has it, or if a parent has abnormal hemoglobin, they can pass it on to a child. There is not when it comes to autism necessarily, but we do know that certain environmental factors can contribute to autism. So if you look at the period of brain development, where we talked about prenatal to the first 3 years. Prenatal means even before you get pregnant, right? Even before you get pregnant. And once you get pregnant, all that period till that child is born. As a woman, you will know that a lot of times the health of a woman before she gets pregnant is important. So we want to make sure that we are healthy. And then a lot of times we don't even know when we get pregnant right away. It takes us a few weeks for most people to know that they are pregnant. So this becomes very important when it comes to what we put in our bodies, right? I'm always looking at eating healthy. That's important. I think that we are so blessed. The West African diet is one of the diets worldwide, which is known as the best because our diets are organic. There are no processed stuff. We don't have additives added in there. So if you're eating healthy and making sure that you are getting all the different types of foods that are going to help in terms of your health is important. Maternal health is important. Healthy mom, healthy baby. So in terms of that, those are some of the things that you can do. Avoiding certain toxins. In my part of the world where I practice, drugs is a big deal. And so making sure that that's not an issue. You're not just taking any medication when you're pregnant. You have to be careful what you take when you're pregnant. Those are all things that you can do. It doesn't necessarily mean that that is what is going to cause autism, but it does mean that you are taking good care of yourself and making sure that your child is also getting healthy things from you. So that is a little different when it comes to what's autism and genetics in that sense. Can someone develop the spectrum at an older age? So one of the diagnostic criteria for autism is that it's something that should have started in early childhood. So you cannot have been developing normal all the way, and then when you are 40, all of a sudden you have autism. It doesn't work that way. However, we are having people that are being diagnosed in older ages because they had these behavior and social challenges when they were little, but it was not identified, especially those that have very high, have a lot of abilities, those who are very gifted, who were talking, they don't have language challenges necessarily. a lot of them are being diagnosed older age. However, when you go back into their history, you will find that these behaviors were there even when they were little. So that in of itself, you cannot just have autism when you're 40 suddenly. It doesn't happen like that. Let's see. So Laura's question is, are there risk factors for children with autism? I'm not sure whether that means, are there risk factors that we can identify in terms of whether a child can develop autism? I'm assuming that's what she means. So risk factors, definitely. We talked about parental history. So if parental age, if it's later on in life when you're having a child, your risk is a little higher. We also talked about family history. If there's a child in the family, if there's somebody in the family that has autism, that can also increase your risk for getting autism. Then we talked about siblings, right? So that also can be a risk. We've talked about environmental factors. Certain heavy metals and toxins can contribute to autism. So these are all some of the risk factors for it. Genetic conditions, things like that, they can all contribute to it. So these are some of the risk factors. And there is, all of that was also discussed when we talked about autism in the first series. So what is autism? When we talked about that in the first series, it's also there. So if you're able to listen to that, that also delves into detail the risk factors as well. What about children with autism? Are there serious health complications as a result of the autism in children? Children with autism can have an increased risk for certain conditions. So seizures, we talked about that. Attention Deficit Hyperactivity Disorder, we talked about that. They can have a lot of GI problems, so constipation. So they can have some of those things as well, which is why having a medical home is important, because some of those things can be addressed. If your child is having any of those, they can look at it and they can evaluate your child and come up with treatment. So definitely there are some health, have some health conditions that they can have that is associated. They have a higher risk for some of those things, and those things can be looked at. Will I recommend that a child with autism enrolled in a school with speech needs or a regular school? Honestly, when it comes to your child with autism, you want that child to be in a place where they can get all the services that they need. So if the regular school provides an opportunity for the child to have access to a speech therapist, an occupational therapist, and behavior management skills, and all of a behavior therapist, that would be a good place for that child. However, if that place does not provide all of that, then you want a place where the child can have access to the services that they need, in which case the regular school will not be a good option. So when we talked about looking at every decision a parent is making in terms of what I can do for my child, it should be in the best interest of the child. And that's what they are trying to do. And so look at a place where your child can have the access to the services that is needed. If your child is not talking, your child needs speech therapy, you want a place where the child can have at least speech therapy. Otherwise, the child can be in a school and you have to find another place for speech therapy. This is where places like Hope Setters become important, right? If a speech therapist can come and work with your child, that would be important for you to be able to access that. In creating awareness and support for people with autism, what do you think we can do and to help, and not necessarily wait for World Autism Week? Thank you, Bob. We can all do our part by talking about it. The biggest challenge, I was just reading an article about Ghana, is stigma. If I have a child who has special needs, the stigma that families go through is just unbearable. We have to educate ourselves, and we have to educate the people that we are in contact with, our friends, our family, our community. Is important for us, all of us, to understand that the fact that a child has autism doesn't mean that a child does not have value. Yes, they may have challenges, but they are equally able to learn. They are equally able to learn in their own way. So all of us can learn more. Sometimes what I have found to be helpful for parents who have children with autism and other special needs is even just asking them, how can I help? Because we assume that they need a certain type of help, and that may not be what they need, right? So keeping the conversation going, the opportunity that you get to talk about it, so that it becomes almost second nature to all of us. Children with autism, they understand kindness, they understand acceptance. So making sure that we have that conversation, our churches make room for them, just in our community, our educational system makes room for them. If you are in a position where you're in touch with somebody who is in a place of policy, talk about it, because we need to have autism-friendly policies in Ghana. We need to have the ability to offer a platform for them, a chance for them, for them to achieve their full potential. So talking about it is important. I think that autism is something that we have to talk about on every opportunity that we get, but then that's me. I want to talk about it all the time because it's important. We've got to create change, and creating change starts from each and every one of us. So thank you, Bob.
Hello, all our videos too are on YouTube. If you want to get them, you can go on YouTube, and when you type the autism with the name of the doctor, you will get it on YouTube so that you'll be able to join in, like the video, or maybe download it and you can share it too. It is free. You can subscribe. It is all on YouTube, free for you, so that you can get to know what we have previously done. Okay, thank you.
Thank you.
Okay. If no one has any more questions, I'd like to say thank you so much, Dr. Dumor. It has been an informative session with you, and we are most grateful that you always are willing to give us this talk. We are most grateful, Doc. Thank you so much. To all those who joined in today, we'd like to say thank you for joining in. We are most grateful to you as well. We'll let you know when the next lecture will be up. We'll put it on our social media pages, and then we'll send the flyer there so you know when the next lecture will be. Thank you all. God bless. Bye.
Yeah, thank you too. Bye.
Thank you so much. Very much appreciated. God bless you.
God bless you too.